is not. It is a double J stent or a JJ stent. So what is it? It is a thin hollow flexible tube that is temporarily placed in ureter to help the urine to drain from kidney into bladder. So it is placed in ureter, so it is ureteric stent. Why it is a J shape? It has curved at both ends, so it is like a pigtail. So one is anchored in the renal pelvis and one is in the ureter. So the curves are there to help to prevent it from slipping. So as shown in diagram, one is above is of polyurethane. It can be also of silicon or metal. So depending on their life shell, polyurethane can be left in situ up to 3 months, and metallic can be left up to 1 year. So in this X-ray, it is the X-ray pelvis both hip. You can see on the left side, the stent is in situ. We can appreciate the pigtails, that is the J-shaped curves are intact in the pelvis as well as in the bladder. Migrated stent can be migrated. In this X-ray on the right side, the J shape or the pigtail is missing in the distal end, that is in the bladder. So it is the distal end is migrated upwards, and in the renal pelvis also it is the shape is distorted. In the next diagram, in the left side, the stent is migrated downwards. The distal end is in the urethra, so it is also migrated stent. Indications why we need the ureteric stent it is to bypass the ureteric obstructions, or post-op it allows healing process of the ureter due to inflammation. So we can put it which allows to give rest for the healing. So where can be the obstructions? It might be the yes, so it can be used in ureteric calculi. So if there is a calculi, we can put stent to bypass that obstruction. Plus, when there is stone surgery or lithotripsy, which is non-invasive shock therapy, and it will break into pieces the stone, and it will dissolve the stone. But the stone can cause abrasion to the wall of ureter. So to allow healing of ureter, we can put temporarily the ureteric stent. Then for reconstructive surgeries like pyeloplasty, where you can see the structure here. So we will ureteric anastomosis will be there, that is ureteric reconstruction. So temporary healing procedure, we can see the blue thing here, that is ureteric stent. And we can also, that is compression from outside is also ureteric obstruction. We can use that. There is no contraindication which is universally accepted, but uncorrected coagulopathy is for bleeding, and we can use iodine contrast. So we need to use iodine contrast. So if there is any allergies, it can be a relative contraindication. So this is just a demonstrative video, short clip. Here renal calculi is there, so there is obstruction. So with a flexible tube, flexible cystoscope, we will first visualize the needed ureter from where we need to put the stent. So in this video, first it is shown that we will put a dye to visualize. In operative procedure, we can also put dye and use C-arm, but it is done earlier. In cystoscope, we can directly visualize, so X-ray part can be skipped. So we have visualized, and this is a guide wire which is passed through the ureter till the resistance is felt. When the resistance is felt, then the stent is placed and the guide wire is retracted. So as the guide wire is retracted, the tube will retain its J shape, and we can later on confirm it by the X-ray. And after the purpose is served, we can again put cystoscope and pull the stent out. It is a minor OT procedure which can be done under 30 minutes under local anesthesia. So this is just a short video for demonstration. Complications can be frequent urination, painful urination, pain in flank due to migrated or displaced stent, which will cause urinary reflux, or it can be blood in urine. These are temporary complications. Patient may adapt to it. Thank you.